Welcome to Undo Unplugged. I'm Erin Harris, founder of Undo Mindset and a former educator.
And I'm Daren Norris. I'm a psychologist in the state of Colorado, and I'm the sole owner for Flying Pig Psychotherapy, which is a private practice located in Parker, Colorado. Primarily, I work with adults and some couples. Today, we're going to kick off our new series, Raising Minds, a journey through the K through 12 mental health. We'll be exploring why mental health matters so much in our schools, sharing real-life stories, expert insights, and actionable tips to support our young learners. Let's get going. Mental health is a crucial aspect of our overall well-being, yet it's often overlooked, especially in our schools and school system. In this episode, we'll set the stage for our series by diving into the importance of mental health in the K through 12 educational system.
Yeah, and our mission at Undo is really simple. We're here to destigmatize student mental health issues and provide resources that really help both parents and educators in supporting our next gen. So go ahead, grab your coffee, take a deep breath, and let's set the stage for this very important conversation. To truly understand the impact, let's look at some eye-opening statistics that really highlight the prevalence and consequences of mental health issues in our K-12. I don't know if you knew this, Daren, but did you know that nearly 1 in 5 children and adolescents are experiencing currently a mental health disorder of one sort or another? Anxiety, depression, ADHD. I think that to really put some context to that, I think about my classroom always. So if I am teaching 30 kids, then I'm saying about 6 of those kids are experiencing some sort of anxiety, depression, ADHD. What are your thoughts on that statistic? Do you feel like in your work that you're experiencing and seeing similar statistics and ratios?
In short, yes. In some regards, ADHD and the prevalence of diagnosis, I would not be surprised if it's actually a little bit higher than that. But again, when you put it in context of 30, 6 are, that's a lot.
I also think it's really important for us to think too about like, this is probably clinically diagnosed versus like just general kids that we're seeing in the classroom. And I think it's also, right now, right this day and age, right today that we're talking, anxiety might be a lot higher than 1 in 5 in our classrooms. Another statistic that I talk about a lot in this work is that did you know that 26% of our kids before the age of 4 are experiencing trauma before they turn 4. So when we talk about needing to do this work in our educational system, I always say like it is truly the most proactive approach we can take to this mental health crisis that we're experiencing. If 1 in 4 of our kids are experiencing trauma before 4, I can't even imagine what that statistic is once they reach middle school, high school, or young adulthood. We have a junior board on our team, and I always say they're actually my bosses because their lived experience is so vastly different than mine. I always tell them I grew up with AIM, and they have literally all of the world's knowledge at their fingertips. And I think that it's really important for us to remember how impactful that is for them. They're in this social stage where a lot of times they don't want to talk about those hard things with their peers, but they're enduring that trauma very repeatedly without much of an outlet or a place for them to really talk through these challenging emotions.
So thanks, Erin, for that. Again, this gives evidence for why this needs to be talked about and why it's such a critical issue. Now that we understand that the prevalence rate's 20%, as you just said, 26%, which seems so astronomically high, in that context, why are we not intervening earlier? So let's break down how these challenges can manifest and what they'll look like at different stages throughout childhood and adolescence, and eventually young adulthood too.
Yeah, absolutely. And just to give a little frame of reference in this conversation, I've taught every single grade K through 8, and then I have taught our curriculum to high schoolers and college age kiddos. So it's been very fascinating to be able to really see every single stage of this. My experience, definitely in elementary school, they're trying to figure out the world, right? They're developing these social skills. They're trying to figure out how to like manage their emotions. They're trying to share, and in their tiny worlds, that is their biggest problem they've ever experienced, is another kid taking their stuff. They're trying to figure out how to express their emotions and feelings. There's definitely in the elementary world, we're seeing an increase in bullying. And then we're definitely seeing a lot of early signs of anxiety. I think it's also important to recognize the current day and age. I think a lot of our elementary school kids see a lot of our big world challenges and problems that our adults are experiencing and really don't understand it enough because they're still very young and underdeveloped brains. But I think it's giving them a lot of anxiety. And I would say that just about every educator coast to coast is seeing in our elementary schools a lot of this anxiety presenting itself in challenging behaviors and some lack of control within those worlds and those rooms. For our middle schoolers, I think we all remember the awkward middle school days where your hormones kind of take over. There's definitely a lot of peer pressure. Middle schoolers are very social beings. They're very, very motivated by their perception of their peers. They definitely are trying to figure out their identities. And through that process, it can be very challenging, especially given the social pressures that they feel from their peers as well. And then I think that most people would say around middle school is when they discovered or felt like they were starting to build some sort of depression or anxiety. And I think it's also really important to name in middle school is when we're really starting to, a lot of parents and people are really starting to give their kids a lot more access to the internet. And I think that access to the internet, especially in an underdeveloped frontal lobe, is giving them a lot of anxiety. You see other kids and the Ukraine exploding. You can't unsee that once you've seen it, in high school, I think that's when they really start to take on some of this academic pressure. They get, thinking about, okay, well, next steps, college, work, what am I going to do? I think there's a lot of burnout in high school. I think especially we're seeing a lot of our high schoolers right now, post-pandemic, really having a lot of burnout. They didn't get some of those social components that they needed earlier on, and so they're struggling in those ways. We're definitely seeing substance use. I don't know if you know, but we almost eradicated smoking cigarettes, and then vape pens were created almost immediately afterwards. Our, using vape pens and things like that in our schools is out of control, in our high schools specifically. I also think that, in high school, I always say it's kind of this age of cognitive dissonance, because you go from your adolescence where your world is your parents' world and your truth is your parents' truth. And that's kind of what you know and believe in. And then you become a middle schooler, you get access to the internet, and then you become this young adult that has opinions and thoughts of your own. And you go through the stage of cognitive dissonance of what is my reality? Is my parents' reality actually my reality? Do I believe that? Are those what actually align to my morals? And I do like to tell teenagers this all the time, that it is a very confusing and overwhelming stage of your life. You feel a little bit crazy because when your reality is not defined, you feel like things aren't, in your control. So anyway, those are kind of my overview of what I have seen in our various stages of our lives and the mental health challenges that we are seeing in our school system. And again, I think that it's imperative to come back to this idea that the internet, no matter what the stage of our children, whether they're in elementary school, middle school, high school, the internet is definitely exposing our kids to things that we haven't seen other generations get exposed to at such an early age. And again, our frontal lobe is not developed until we're 25 to 35. So when they are seeing all of these things on the internet, whether they are elementary, middle school, or high school, it is greatly impacting their mental health and their understanding of the world around them.
I love how you kind of did that, Erin. You broke it down into the elementary, the middle, and the high school. Breaking that down, we can see these challenges and I guess how they relate to children of different ages. We say we service K through 12. Well, there's a big difference between first graders and 10th graders. So I think, Erin, you have some more compelling data you want to share with us.
Well, not necessarily data, but I think that it's also really important to kind of understand where can schools play a part in all of this. I think that for me, I have worked in underserved communities where schools are very much a go-to resource for a lot of families. It's oftentimes when the kids feel the safest and their basic needs are being met from Maslow's. The last school that I worked at, we had a full health facility where kids could actually see a doctor, not just a nurse that gave a Band-Aid. We really make sure we have mental health providers to really making sure that kids are getting fed whatever resources they don't get at home. We want to make sure that we are able to provide them. And I think that it's really important for us as an educational environment, a safe haven for these kids in such a stressful world, that we have to remember we have a responsibility to provide them with the essential supports they need in this mental health crisis. I think that we are doing a lot of really great things in our schools to help them. We're seeing an increase in mental health professionals. We're seeing more therapists, psychologists, all sorts of different people that are doing some of these touch points with folks. I always use myself as an example, though, of why that wouldn't have necessarily been the most successful approach for me. A lot of times the kids that will go to the school counselors or therapists or whatever are kids that are behaviorally exhibiting some of the effects of their trauma. I definitely experienced trauma in my childhood, but as a girl, maybe the narrative for me was always to just kind of go with the flow, be good, and do my part to just be part of the system. I never would have been the kid that is showing you I'm experiencing trauma to then be sent to the school counselor to then get that kind of support. I do think that the program we're developing at Undo is the most equitable approach that we can take to this mental health crisis, because we're really able to make touch points with every single student. It's computer based, so you're not reliant on that human capital to really meet the student's needs. Is it still great to have school therapists? Absolutely. I always say the more tools we have in the toolbox, the better, because, EMDR might be great for somebody when talk therapy might be great for somebody else. There's all different resources for how we can address mental health. And I think giving our kids skills and tools prior to trauma, so that when trauma happens, they're really able to file that trauma away correctly, is the best thing we can do for the equity of all of our students. Will it work for all of our students? I don't know. We'll see. Is it the end all be all solution for all of our students? Absolutely not. Should it be in place in conjunction with what we're already doing? Absolutely.
These really highlight the critical nature of mental health and mental health access early. Prevention is so much better than post-event intervention, like just from a resource management standpoint.
Proactive instead of reactive.
Yep, proactive, exactly.
Mm-hmm.
So that's what I love about this program. So keep going, Erin.
Wonderful. And I'm really excited, Daren. I'm super excited that you're joining us on this new season of our podcast. So we've changed up how our layout is. If you were following our last season, this season, instead of talking about our different skills and tools that we teach, we're really going to focus on the different initiatives and those communities that we're hoping to serve and support in this way. And so what we're going to do is really expand those initiatives, talk about our incarcerated initiative, talk about our transient initiative, and so on and so forth. And it will maybe be, 10 episodes each or so. And then we'll bring in different industry experts. We're really excited to do this work because it truly is a way for us to build resilience, foster a culture of mental wellness, not just for our students, but for our home lives, for everybody who's supporting our students. Specifically in this series, we are going to focus on our schools. So we will have school administrators, we will have students, we will have school counselors, we will have counselors that are not in schools but are supporting our students. You name it. Anybody who is really involved in our next gen's lives and making sure that we are being proactive in this way. We want to hear from them and see how we're doing, see what we could be doing better, see what is working, what's not working, and just hear their stories and experiences. We are having an exciting and insightful series ahead, but before we wrap up today's episode, we have a favor that we must ask you all. We want to hear from you. So if you have an experience in mental health challenges in school, either as a student, parent, educator, any of those positions that I just listed, what questions do you have about supporting our kids' mental health? If you want to share stories with us, really anything you want to get involved in this conversation with us somehow, some way, feel free to reach out to us at unplugged@undumindset.org, and your insights could really help us shape future episodes.
And don't forget to subscribe and leave a review. This is really important. It's the best way to support this podcast and make sure we keep going so we can continue spreading this important message.
So thank you so much for joining us on this first episode of Undo Unplugged in the second season. Together, we can shift the narrative around student mental health and really create an environment where every child can thrive.
And until next time, Take care of yourself and your family.